You. And thanks everyone for coming. And I do appreciate those who put their camera on because it's really nice to see people's faces. So just to start off, I'd like to acknowledge that Okanagan College sits on the unceded territory of the Silks and the Okanagan Bands here in the Okanagan. How I always like to start the sessions is just to try and get a feel of what burning questions you need or want answered. So if you can just let me know, we've got quite a few people, but if you can just let me know one burning question or one of the reasons why you went into this, came to this session and what you hope to get out of it. So what I'd like to do is I'd like these sessions to be a little bit interactive, and it kind of helps people to understand the program and kind of what they're getting into. So can anybody tell me what LPNs do? You can write it in the text box. If you have I don't think you do, have the ability to annotate at the bottom, you can let me know, or you can just tell me. Oh, I've got a delay on my screen. Does anybody want to tell me what LPNs do? Have any ideas? You can guess. There's no wrong answers.
They provide support to the RNs and to the doctors.
Yeah, absolutely. They do exactly that. So not only do they provide support to the RNs and to the doctors, but they actually are autonomous practitioners, and they follow their own scope of practice and their own standards, and they manage the care autonomously of clients in stable and predictable states of health. So we LPNs do now, their scope of practice, especially in British Columbia and Alberta, has grown and grown over the last 5 to 10 years, and it's quite a broad scope of practice now, and so they do work completely independently under the conditions set out by our registering body. So you're considered a professional, and you're bound by your professional body, that is the BCCMP, which is the British Columbia College of Nursing and Midwifery, bound by their limits and conditions. So where do LPNs work?
They can.
Sorry, go ahead.
They can work in care homes, obviously in hospitals and other like long-term care facilities.
For sure. Yeah. So they work in acute care hospitals. They work in long-term care facilities. Anything else, Shayla? Were you going to say something else?
No, Destiny covered what exactly was.
Yeah. So not only do they work there, but they work in the community. So they do home care. They work in prisons. They work in mental health facilities, rehab. They work with the homeless. So they work with the street organizations to provide care. They actually work everywhere you would see a registered nurse or a degree trained nurse, and kind of where you don't see them as much is in the specialty areas that require further education, or where you would typically find a client that is in an unstable or an unpredictable state. So in a critical care area, like the intensive care, possibly the catheterization lab, in the trauma and resuscitation portion of the emergency department, and pediatrics. They're only able to work with certain populations. So really, we are seeing LPNs work in all the areas that you'd see across the whole care continuum that you would see RNs work. And so what personal attributes or characteristics do you think an LPN has? Do they work at all in emergency departments? Yes, Carol, they do. They just don't work in the trauma and recess. They can act as a support for the registered nurse, but they can work in the, and they do, like in Shuswap Lake General Hospital, they work in Emerge. Here at the Vernon Jubilee, they work in Emerge. So it's just where in the emergency department they work and how big their scope of practice is. They can work in the casting clinic. They work in the operating theater as operating theater techs in as well. So they do work everywhere that you would see, typically see a registered nurse, where they have predictable states of health. So what attributes or personal characteristics do you think an LPN needs to have?
They need to be able to, like, professionally be able to work with the people around them, show time and patience towards their patients. They have to have good time management, that kind of general stuff.
Yeah, those are exactly right, Mercedes. Those are some of the qualities they need. So you kind of hit on a few different things. You talked about cognitive and abilities around organization, professionalism. You talked about personal attributes around and social attributes about interpersonal skills, and how you find out whether you have the appropriate personal attributes and characteristics is if you go on the BCCNM website. They'll lay them out. There's a document there that shows all the attributes that are required for entry into a nursing profession. So some of those include physical attributes. So you have to be physically able to do the job as well. Mercedes, were you going to ask something?
No, I was just answering.
Okay, what's your answer?
Mine?
Do you have, you were just the one who was answering, weren't you?
Yeah.
Okay, no problem. Does anybody have any other ideas of what personal characteristics someone may need to be an LPN? Shyla?
I think in a roundabout way, you need to have thick skin. You need to be able to take things in stride from patients. Yeah. Absolutely.
So part of those interpersonal skills is your coping ability, because oftentimes in nursing, we experience things that are quite emotional, and we have to have strong interpersonal skills where we can cope with the situation at hand. We know how to reach out. We know how to manage situations that are emotional, and that may escalate. So yeah, that's absolutely right. So good communication and organization skills is correct as well. Thank you, Carol. All right. I've got a delay on my computer. Here we go. Okay. So this is kind of what nurses are best known for. Here's some of the words that kind of come to mind when you think of nurses. And I'm just going to show you kind of what a licensed practical nurse, who they are and what they do. And this comes from the acute care sector, but I think it kind of gives a nice broad understanding of what nursing is all about. So it's just a short little video for you guys to hear and listen to. Please let me know if you can't hear it.
It takes a caring heart to work with people in need of medical assistance, and our next guest doesn't think twice to provide that care. Let's meet a licensed practical nurse.
Hi, I'm Viviana. I'm Sarah. Welcome to St. Paul's. Let me show you around the best ward in the hospital.
Sounds good. My name is Zoe Pichette. I'm a licensed practical nurse at St. Paul's Hospital in Vancouver. I'm the first stop and the last stop when you come into the hospital. And I'm the one that assures continuity of care. I come in the morning and I take a report from the previous shift, and then I go and I check on all my patients, make sure they're okay. I'll administer medications, injections, I'll do wound care, I'll monitor your ins and outs, which means how much fluids that come into your body. The majority of my job entirely surrounds all the assessments that I do of you during the day, and I document everything. The difference between a registered nurse and a licensed practical nurse is entirely defined by my scope of practice. My scope of practice states that I look after stable patients with predictable outcomes. So the sicker you are, the more chances you're going to be with a registered nurse.
So what goes on in here?
Well, this is the nerve center of the unit. That's where the unit coordinator sits and directs traffic. I check lab values. It's also where we house all the charts. I work 8-hour shifts, 6 days in a row, 2 days off. When you start off on an on-call basis, you take the hours that you're given. There's nothing really specific in terms of hours. You just can't be afraid to work the long hours or the short hours. There's 2 ways to become a licensed practical nurse. You can either do the Access to Licensed Practical Nurse Diploma program, or you can do the generic Licensed Practical Nurse Diploma program. You have to have your grade 12 math, your grade 12 biology, your grade 11 chemistry. Within the realm of being a licensed practical nurse, you can work on different areas. So acute care on the medicine program, like at St. Paul's, you can work in maternity. You can also work for the College of Licensed Practical Nurses of BC. You're able to transfer some of your education and your experience towards becoming a registered nurse. As a licensed practical nurse, you have to be comfortable enough to speak with people. You need to glean information from them, talking to them and making them feel comfortable and trust you with their personal information. I do a lot of patient teaching. I explain the procedures that's going to happen to you, the little things that you can expect during your hospitalization. All right, so we're going to be checking in on Catherine this morning.
Hi, Catherine.
How are you feeling today?
I'm all right, a bit tired,
Yeah, do you have any pain anywhere?
just achy.
Do you want to take her temperature?
Sure, I would love
Okay.
to. All right, Catherine, here we go.
Oh, excellent.
Is that normal?
Yeah, 36.8, that's exactly where we wanted, so no fevers. You have to be extremely good with your hands at this job because you hold many little finicky tools and you're doing many things with your hands at the same time. This entire job is about paying attention to detail, and it's tiny little things that people would think are innocuous are sometimes the most important.
So how often do you have to check up on your patients?
Every hour,
Every hour.
minimum.
How many patients do you normally have?
It depends. It depends if we're short-staffed or fully staffed, but it can go anywhere between 4 to 6.
So you really have to be organized and manage your time properly.
That's an understatement. The top 2 skills that we need to do is priority setting and time management. I've saved lives. I've been there while doing CPR and chest compressions, and the doctors are there and you get a heart rhythm back. That feeling, that gratification, you go to bed knowing that you've been productive and you've been a good person every day.
Sarah, thank you so much for showing me around. It really is the best ward in the hospital.
Thanks for coming, it was fun.
Once again, I'm Viviana for Career Trek, reminding you that this career could be yours. We'll see you next time.
So that's kind of a snapshot of a day in the life of an LPN working on a very busy medical floor at St. Paul's Hospital in Vancouver. So we do see a lot of those here in the Okanagan as well. So let me just pull this. So how long, let's talk a little bit about the course. So the LPN program is about 1.5 years long. It's like 18 months long. it has a cumulative clinical practicum experience after each semester. So there's a period of time where you do intensive learning within the classroom and the lab. And then when that ends, you go into a clinical practicum at each semester. So we do that through all 4 semesters. And then the 5th semester is your preceptorship, where you do an extended period within a clinical area, whether that be acute care, depending on where you are or what your preferences are, and you have a preceptor and you work along with them for I think it's 12 weeks. And then once you've completed that, you've completed the program. Now, as of 2022, we have a new Canadian Practical Nursing Registering Exam, which is a new CLEX exam, which kind of follows the same type of exam as our registered nurses take and our nurse practitioners take as well. So that exam is entirely online, and it's a SMART exam. So depending on how you answer your exam allows you to, it will provide your own basically personal exam. And your exam can take anywhere from 45 minutes to 3 hours, depending on how you answer that final completion exam. Once you successfully complete that exam, then you are moved from a student graduate nurse to a licensed practical nurse. So again, as I told you, LPNs work in all of these areas. Within our clinical practicum sites, we work in the community. So we work with the Okanagan bands. We work with the First Nations bands. We work with the street nurses down here in Vernon. We work in continuing care, rehab. We work in acute care. We work in long-term care. And so we kind of run the gamut during your clinical practicum. And we also offer, and I think we'll be able to start up again now that COVID is winding down, there is a clinical practicum that our students we're looking to restart again next year for your clinical practicum in Thailand. So you do your community clinical practicum for 2 weeks in a very small rural community in Thailand. And we've got excellent feedback on that practical experience that those nurses do. So here are specifically the admission requirements. So these are the minimum entry requirements that you need to have. So you need to have a high school graduation, mature status, or equivalent. You need to have a minimum of 70%, as you heard, in English, 12, or a grade between 50 to 59 and a score on the LPI test. For maths, you need a 67% in pre-calc. You can see the different maths that you need it there, or minimum a grade in these continuing education maths, and then the biology requirement. So you need grade 12 biology, which includes human anatomy and physiology, or an equivalent for adult basic education. And before you are allowed to successfully enter into the program, you have to take the prerequisite, which is the PNUR 113, which is the pre-practical human anatomy and physiology. Biology 12 is a prerequisite for that. You need to get a 70% as a minimum, or you will not be allowed to be admitted into the program. So for those of you who may be on here who are high school students, you can take this PNUR prior to finishing high school. You can take it as an option, or you can take it after you graduate. Does anybody have any questions about those? Palvinder?
Yes.
Do you have a
Hello.
question? Hi.
Hi. Yeah. So I'm in a healthcare program right now, and I want to do LPN. How can I? Is there any bridging program or anything available?
Sure. So, Palvinder, are you in a HCA program?
Yes.
Okay, so Okanagan College does not provide an access program from the
Okay.
HCA program into the LPN program. So what you would have to do is you'd have to look at your prerequisites and see how
Yeah.
they fit, and you'd have to start at the start within the Okanagan College LPN program. There are
Okay.
some programs in British Columbia that do provide access programs, but I don't know what the private colleges do, but there are some public colleges on the coast that provide an access program, but we do not within Okanagan College.
Okay, so there's no bridging or anything, right?
No.
Okay, so all I need to just fill my requirements and then see what I need, and then I can start, right?
Yeah. So and I'll talk to you a bit about that as we go along.
Sure,
What we
yeah.
do is we rank our program like we do the BSN program. So we leave the admissions open for a period of time, and we look at the pool. Actually, the admissions are open up to the day, almost the day before the program starts. But if our
Okay.
program is full, they in the at two different times in the year, they'll take a look at the program or the applicants, and they will rank them. And so they'll rank them on academic achievement. And there's a few other ways that the admissions office will rank them. We have some very good students. Obviously, the LPN program isn't as competitive as the BSN program. What we have found is that we have a high number of applicants into our Kelowna program, obviously,
Okay.
and we have lesser number of applicants in our outlying areas, so Penticton, Salmon Arm, and Vernon. And so that ranking program doesn't go across the entire Okanagan region. It ranks per site, so per
Site, okay.
campus. So it's a little bit harder to get into the Kelowna practicum, and then obviously it's a little easier to get in, usually because the numbers of applicants are less in the Vernon, Salmon Arm, and Penticton programs.
Okay. I'm in. I'm basically in Vernon, so I will be going into Vernon. So.
Okay.
Yeah.
Yeah. So they just pool them till they get a certain number prior to the start of the program, and I'll talk to you about when the program starts, and then they'll look at them. Some years we have lots of applicants. Some years we have a hard time ensuring we get the 20 that we need, and that may be for various reasons. Life happens to a lot of our students, and you have to plan in the future. Sometimes the PENR 113 is a little harder than people have thought it would be, and that's because it is an online program, 100% online.
Okay.
So is there a competitive average usually for Kelowna? It does depend. Yes, there are less applicants for the January intake, typically. So from a ranking perspective, because there's less numbers, it may be less competitive in January. But having said that, over the last couple of years, we haven't seen that much of that. But yeah.
So it's like you guys offer like every year, or is every 2 years?
We'll go to the next slide and we'll talk about that.
Sure.
So we follow, all PN programs in the province follow a provincial curriculum. So that's standard set out by the government. And therefore our program is transportable, right? So you can start in the program in one place and move to another place. The credential you end up with is a diploma in practical nursing. And you are a professional that is registered with the BCCNM, which guides your practice. So the program length is 62 weeks of instruction over 70 weeks. So you have a break in the first year. Over the summer, there's a 4-week summer break, and then you have 2 weeks at Christmas.
Okay.
So we have 4 semesters. So the first semester is 13 weeks. And then there's a 3-week practicum. And that's in long-term care homes. The second semester is 12 weeks, I believe. And then there's a 4-week practicum following it in long-term care homes. Then the third semester is acute care. So we go into, we learn all about acute care practice. That's a 13-week study period. And then there's 7 weeks in clinical practicum. And then you come back for 8 weeks in semester 4, which is community mental health and pediatrics. There is a 2-week practicum, and then you enter into your preceptorship to the end. So once you complete those successfully, you are eligible to write your national exam after that point. After you successfully complete your second semester practicum, you can request a certificate that allows you to work as a healthcare assistant from that point forward. So once you have finished your second semester, you can actually then go to work as an HCA if you choose to do that. There's lots of beeping, but I don't think it's people asking me things. So why take Okanagan College's practical nursing program versus the other ones that are here in the Valley? There's lots of information here that you can find on that. You can just go on the website. We offer very small class sizes. We have a high ratio of nursing instructors to nursing students, both in the classroom and in the lab, as well as in the practicum site. The classes are offered in 4 communities in the valleys. That is Penticton, Kelowna, Vernon, and Salmon Arm. Our program is consistently rated very highly by both program grads and employers. Our employers tell us, which is Interior Health, as the biggest employer, that Okanagan grads are the preferred graduates of any PN program. So our students have 96% find employment at the level they want, whether that is casual or full-time. We have consistently had 100% passing rate for the registering exam for the last 5 years. Or actually, there was only 1 year once in Penticton where we had 1 student unsuccessful, but other than that, we are higher than most of the programs in Canada and the programs in British Columbia with 100% passing rate. 94% of our students tell us that they're very satisfied or satisfied with the program. They talk from a qualitative perspective of the excellent quality of instruction, the relevance of the materials that are covered, the personal growth that they experience throughout the program. We use many innovative teaching methods. We have simulation labs in most of our campuses. We do lots of different online virtual simulation, and we'll talk about that in a minute. And we do go out into our community and work with our community partners to see what healthcare is being delivered in our communities we live. So what does a typical school week look like? Well, it can be a combination of any of the 4. So as I said earlier, so we have face-to-face classes, and yay, we have just heard, yay, that we are going back to face-to-face learning come the fall, which is fantastic for both our students and our instructors. But we do have components that we do online as support. So we use a Moodle online learning platform to support your face-to-face classes and to allow you to do some work on your own and free up some of your time during the week, where you can kind of self-manage your schedule to a bit. We do nursing labs. All our programs in every semester have 2 full days in nursing lab a week, which is a huge amount of nursing lab time when you compare it to some of the other programs in the province. Tanya, did you have a question? No? Tanya? You're on mute, Tanya. And then
No,
we use...
no questions from me. That's strange.
Okay, you just flashed up on me, so I was wondering
Did
if you had a
it?
question.
Oh,
Yep.
that's strange.
It's okay. It's all good. And so so that those 2 full days allows you to have lots of practice on your skills. And so when you go into your clinical practicum, you've had enough time and enough oversight and support by your instructors that you feel confident and secure going into lab. We use practicum sites all up and down the valley, all the acute care hospitals, so Shuswap Lake General Hospital, Vernon Jubilee, Kelowna General, Penticton General, and a multitude of care facilities across the valleys, all the way up and down. Like I said, we have completed our first inaugural Thailand clinical practicum for 4th semester, where we took 12 students to a very remote area in northeastern Thailand, where they worked in the villages with the home support workers and the nursing faculty and the nursing students from the university there in Thailand, and delivered care to the community of 3 little villages, which was a great experience and a great immersive opportunity for them to learn and practice their cultural safety. Does anybody have any questions about those? No? And so these are our students in Thailand, and these are the monks. And so part of their remit of our students was to do health checks on all the Buddhist monks in the community. And the Buddhist monks are held in very high esteem. And as you can see, all the students are down on their knees, and that's because the monks, from a cultural perspective, sit higher, or they are higher than anybody else in the temple. And so our nurses got to do their health checks on their on the monks within the villages they were working at. So just as a kind of an example of some of our learning activities, you can see here, I've got this CanSim, and I'll show this to you, but we use all kinds of different online and we had to really pivot to deliver online over the last year. But we used lots of interactive activities that we did, lots of whiteboards, lots of breakout groups, doing polls. We like to use Kahoots. We like to do a lot of pre and post assessment, lots of support, independent kind of learning support. And so here's kind of an example on how we teach
in Wuhan. Investigations found.
I'm not sure if this is coming up. Can everybody see this? Can everybody see a COVID-19
Link, but that's
link? Probably not. No, didn't think so. So just a second. Just a second, and we'll do this again. I'm going to share my screen. And now, can everybody see this now? It says COVID-19 assessment and PPE.
I can see it.
Great. So this is kind of an example of some of we use gaming technology and learning critical thinking skills. So we've got an interactive, this is just one of the many type of virtual simulation things that we like to use. So this one was specific on COVID-19, and we introduced this last year in March, surprisingly enough. And just to talk about what our students needed to know around learning outcomes with COVID. And I won't go through it step by step, but it's just to kind of give you a flavor of some of the innovation that we do. So here you'll see we've got a case summary. It'll kind of lay out what's going on. And then
In December 2019,
there's
there was a
some,
cluster of pneumonia cases in the city of Wuhan.
there's some theoretical knowledge that's backed into it. And I'm just going to pull this forward because it's going to take too long. And then it talks about the critical points once you review that. And then they kind of actually go through a scenario where someone's talking on the phone.
COVID-19 phone line. My name is Jordy McKenzie. I'm a public health nurse. How can I help you?
I'm Robert. I think I have a fever and I don't feel well.
And so you can see that it actually runs a scenario out for you. You get to choose what's important, and then it allows you to continue, and it self-corrects you as you go along. So does anybody want to hazard a guess what information this public health nurse may need to know? Does anyone, don't worry about it. There's no wrong, they're all a little bit correct. So does anybody want to stick their head up and decide what this is?
I will.
Yeah, go, Shayla.
Select the last option.
Yes, that's correct. So you can see that when you select it, it allows you to continue on. If you choose the wrong one, it sends you back, and you have to choose a new answer. So I'm just going to share the presentation again because we're almost done, and then I'll ask you any more questions. So program cost is a good one. We are a public college, so we are much cheaper than the private colleges by a significant amount. So that's how much the 2021 program costs are as per the calendar. They are subject to change. And then you have program materials of about this much. And that will be for textbooks, which many of our textbooks have migrated online. So they are much cheaper. You'll have to have uniform and shoes, and you'll have to have stethoscope. So those are the kind of costs, and we have specific, financial aid can give you the exact specific breakdown of costs should you want it, but these costs are significantly cheaper than the private colleges. Does anybody have any questions about that?
I do.
Sure.
Is your program eligible for the loan forgiveness program offered by the government?
I don't know that, but that's a really good question for financial aid.
When I had spoke to Sprott Shaw, they told me about the loan forgiveness program, and the way it was explained to me was that once you have your first 2 semesters, as you mentioned, and you get your registry number and everything, you're allowed to apply for the loan forgiveness program, and as long as you work around 4 shifts a month in an understaffed, potentially underfunded hospital, over a course of 5 years, they'll pay for your entire tuition fee.
Well, if that's a government initiative, Destiny, I'm sure it would, because we are a public college, I'm sure we would be part of that program.
Okay, would you guys come up on Student Aid BC? Like if I went and looked on their website?
Yes.
Yes.
We would. And what Financial Aid and Awards is telling us just about student loans in general is that they are giving away, no matter what program people are in, they're assessing every application, and quite often people are being granted back part of the money. So if you apply for a student loan and then you're approved, you might get a letter that says, okay, you've been approved for $9,000, let's say. However, 2,000 of this is a grant, so you'll only have to pay back 7. And it's completely based on financial need, living situation, and whatnot. So a little different from that one that is the one you were talking about, Destiny, because there is a program such as that too for people in medical school and healthcare type programs, but there's that other option that financial aid seems to be seeing a lot now. So that's a really nice break for many students.
Thank
Okay,
you, Tanya.
awesome. Thank you.
And the other thing is we have a fair bit of grants and scholarships for our PN program that you guys can avail of, and they're really good ones. And they're some of our scholarships or grants that are provided are based on need, and some of them are based on performance. So we have a mixture of both. And I know that they've been life-saving, some of them, for our students to date. So these are the questions that lots of people always ask us. So what's the difference between the LPN and the RN? And I think we've kind of talked about this. So I'm not going to spend too much time. So the LPN works with clients that are of stable and predictable states of health. That's the difference. And they don't work in areas where they require specialty training with specific vulnerable populations. For example, pediatrics. Will Vernon be running this coming year? No. August is Salmon Arm start. Vernon will be starting again in August of 2022. So that is the big difference between them. Is it difficult to get into nursing programs? Into the different nursing programs? I think I answered that. It depends on where you're applying and what pool of candidates happen. Obviously, Kelowna is a far more attractive spot, so we tend to pull some people from the coast a bit. But in our outlying areas, it's more our local populations that are looking to come in. Can you transfer from a PN to a BSN program? Yes, you can. We at Okanagan College don't provide that. There is a small bridging program at UBCO, but ultimately, to be perfectly honest, you will still be doing 4 years. So it doesn't really give you much of a leg up. However, there are other bridging programs that provide a significant amount of your prior academic work in your PN program. The University of Northern British Columbia has a really good access program from PN to BSN. Athabasca University in Alberta does as well. And I think there's one of them on the coast that have a BSN that provides that. So what you really have to do is look around, but it's not that great here in the Okanagan. How much does a LPN make? An LPN starting wage is $28.42, I think it was. I have to look. When I get out of this program, because I can't see my notes, I'll tell you exactly what it is. And it goes up to about $35 an hour. And of course, working shift work, working weekends, so nights and weekends and holidays, you get extra as well as overtime. Yes, you absolutely have to work shift work. If you think you're going to go into nursing and not work shift work, you are going to have to work shift work. You won't always have to work shift work, but when you are initially in nursing for the first long while, for me, it was probably about the first 20 years, you have to work shift work and you have to work holidays and you have to work nights. We take care of people 24/7, 365 days of the year. And we need nurses through all of those times. How many men work as nurses? Well, this is actually changing. When I used to work in the UK and teach in the UK, it was about a 50-50 split. In some countries, there's more men than there are women. When I worked overseas, Canada, we're still around probably 85% women, 15% men. But I've just seen over the last couple of years here in the Okanagan, a definite change. And we've had in our cohorts this year, we've had 20% of our students are men. So I'm starting to see what I was used to in other bits of the world. This female nursing profession is is kind of a North American thing. And men work in nursing in most other places in the world. Is there a need for nurses? They are an absolute need for nurses. Not only has this pandemic affected how much healthcare professionals we will require in extended care facilities, long-term care facilities, and the impact of these infectious diseases. But in Canada, we have a retiring nursing population across the board, and we will hit a critical nursing shortage between probably it'll start around 2025 if we don't start increasing the number of nurses we have moving forward, as all our baby boomer nurses and the majority of the population of nurses, which are aging, begin to age out of the system. That's all I have for today. I'm delighted to see so many names, and I'm looking forward to seeing you in the PN program in the near future.